Hi, welcome to Chat Communications Happenings and Trends. So if you are a regular viewer, welcome back. And if you're new to the program, welcome. Today we are going to discuss healthcare in America and living with an invisible disability. Speaking of which, we tend to talk about healthcare a lot. It's very important to us, and that's why we want to maintain this conversation, because it is, as our guest has described it in the article that we are going to be discussing today, Walker Bragman, a humanitarian crisis in the United States. So please welcome Walker to the program.
Thank you for having me.
Thanks for coming on. So Walker has written a really interesting piece, and we will link it below if we have not already done so. It's called, again, Living with an Invisible Disability in Donald Trump's America. Now, he does outline the first part of it, saying that, well, the United States has traditionally been under kind of a problematic healthcare system, to say the least. And it goes from prior to the ACA through implementation of the ACA and full-blown ACA actually having been here through what the current administration is doing and trying to do. So first off, just to give you some numbers, about 600,000 Americans each year go bankrupt due to medical expenses. Now, this is in a time where people are making about a little under $35,000 a year on average individually. And it is outlined in this article as well about people are spending a third of their income total on medical expenses each year, about $10,000 per individual. And that is actually after implementation of the ACA, it's supposed to be affordable, right? But it is anything but. Now, in this article, Walker speaks about a young woman who had a pretty rare condition, and she was diagnosed when she was 19 years old, always assuming that she was going to be healthy and very independent, potentially the prime of her life. Most 19-year-olds are, but she came out with this rare condition. And so this is kind of outlining her story in relationship to the overall healthcare system within the United States. So just to begin with, she has something called, and I'm probably not going to pronounce this right, so Walker, help me out if I mispronounce this. It's Ehlers-Danlos Syndrome?
Ehlers-Danlos Syndrome, yes, you got it.
All right, awesome. And it sounds pretty painful, to say the least. Walker, could you please kind of outline this syndrome for us?
So it's a genetic connective tissue disorder, and there are different types of it. The subject of my article has the most common type of it, and which is also the least severe, but it's still fairly crippling. It changes the way that protein is, that collagen is deposited, if I'm remembering this correctly, and it causes constant pain. Your skin can be stretchy. I mean, a lot of people have this. It's just not talked about. There's not a whole lot known about it, despite the fact that the most common form is not like a super rare illness. And the management of Ehlers-Danlos is really poor today with private insurance. I mean, I would venture to guess most people who have it, if you don't have a substantial income or a very solid healthcare plan, you can just end up living without treatment, and people can't see that you're sick, and that's kind of the basis of the article.
Well, you mentioned that this woman has healthcare or health insurance, and it sounded like a pretty good plan, right?
Right. So she has, and obviously, I don't want to speak to her personal experiences too much, but she has a health insurance plan with a high deductible, or a higher deductible than she can afford, really. And so she's done an incredible job, I think, Speaking to this young woman, she has done an incredible job of managing her illness, despite that. But it's difficult, and it's hard talking about it, and it's hard to be open with people that you don't know about it. But I was very impressed, and through the course of my reporting, she's just an incredibly strong and brave young woman.
So if you are, you're obviously a viewer, not you, Walker, but our viewers, I really highly recommend reading about her particular experience. That way you can kind of see just at an individual level what it's like to kind of struggle through the American healthcare system as it currently exists. But let's kind of get more onto the broader picture, kind of what you're trying to depict here. I'm not sure if you're kind of make this argument, but at one point within the piece, this young woman mentions about her specialist being pretty far away and difficult to find. Now, something that I've always heard as an argument for the American healthcare system are the accessibility of doctors. That doctors are everywhere and you can pretty much get one immediately. But that isn't really her experience in your article. In fact, it sounds like she has to travel anywhere from 1 to 2 hours to see her doctor. Do you think that a condition like this, I don't know if you've researched other conditions, but have you heard about any other people having the same problem?
I haven't. I didn't really look at. When I write an article like this, I focused pretty much on my subject and then how her problems related to broader issues, but different illnesses. No, I did not. But I would imagine that this is a fairly common problem for people that live in rural towns. And I don't know. I should say I don't know how whether or not a nationalized healthcare system would really change that. It would just make, once you get to where there is the specialist, you wouldn't have to worry about the cost. I mean, a big problem that the subject of my article faced was that when she would go to the doctor, it was hit or miss whether the doctor would know what she had. And so she would be paying for the visit, but then it would be effectively useless. So she'd have to pay for gas, and she'd have to have somebody from her family take her there because she's not able to drive. And that gets expensive, and especially if you have no income. So a nationalized healthcare system would address the problem, but maybe not directly.
Right. So one thing that I've heard against a national healthcare system was exactly the experience that she's having with the private healthcare system that we have in place, was the doctor being available and around and easily accessible. And it sounds like it's not really that much different, at least for her experience. And let's talk on the affordability issue. So there were some things that she was basically either having to figure out how to pay for, or I guess not paying for. That included kind of pain management, massage therapy sessions, or something along those lines to help, because she's in a lot of pain, this individual. Well, I ended up doing the math, and it amounted to, just for what she is supposed to be getting alone, this is with insurance, and this doesn't include her doctor's visits, this doesn't include the gas expenditure, anything like that, or her cost of wheelchair, but it totaled about $1,150 a month. And so that sounds a little bit out of reach for a lot of Americans, especially when they're, again, making about a little under $35,000 a year. Wouldn't you say so? Like, is this something that you think is actually reasonable for the current healthcare system that we have?
I think the current healthcare system we have is barbaric. I think that private health insurance is one of the things that we will look back on in 50 years and wonder how we lived with it, and how we didn't there weren't people screaming in the streets, that millions of people couldn't afford care or couldn't see a doctor when they're sick. It doesn't make any sense to me. And in a way, I think that it's a form of oppression akin to any that we've seen in this country. Just there, it's without chains, but it's your health. And if you can't get better, or you can't manage your pain, and you can't walk, and you can't work, and what kind of life do you have? You're a prisoner in your own body. And I don't think anybody should have to live like that.
Absolutely. It's a horrific system as it currently exists. Now, I want to just mention that I don't know if you've seen kind of the recent data about poor Americans living about 15 years less than wealthier Americans. And part of that's contributed to the current healthcare system, because what our healthcare system does, it basically selects who gets to live and die. You also throw out statistics from the CDC from 2014, and this is where you mentioned about it being a humanitarian crisis, that about 40% of annual deaths from each of the 5 leading U.S. causes are preventable. Could you speak on that a little bit?
Absolutely. It's no secret that if you have money and you have great insurance and you have the time and the luxury of being able to go to a doctor, you get great care. We have some of the best cancer doctors in the world. We have some of the best doctors generally in the world, and our health outcomes for the wealthy are superb. But that comes at a cost. Now, that comes at a huge, huge cost to everybody else who's shouldering the burden for effectively this elite class of people, and it's absolutely unacceptable. The statistic about the leading causes of death, many of those deaths being preventable, that is an indictment of our country. That is an indictment of us as a people. It's astounding to me that this isn't talked about more, and it's astounding to me that I haven't seen it described by really anybody else as a humanitarian crisis. I can't believe that this isn't headline news every day. Instead, we get, Russia all the time, or we get, can you believe what Trump said? Like, I don't give a fuck what Trump said. I'm worried about the these people that I talk to, or that I, in the course of my reporting, or that I see when I step out the door of my apartment. How is that not news? This is every day for people. This is real life. This is the stuff that affects them. And if we don't have a media that's covering it, we are failing. We're failing our people, and we're really failing ourselves.
Now, one thing that the Affordable Care Act was able to do was to assure that people with pre-existing conditions were not left out of the healthcare system, because prior to the ACA, people with pre-existing conditions were likely to not be covered by insurers. And so the ACA was able to bring up those individuals and to somewhat cover them. Of course, it still didn't really address the affordability aspect that many people are facing and are currently facing. You mentioned that about 28 million Americans are still without health care coverage. So in that regard, people are frustrated, understandably so. They can't afford the health care. But speaking of Donald Trump and what he said, he mentioned something during his campaign about wanting to go to a system that would, and I think that it was somewhere kind of suggested that it would be more of a universal system. In fact, he speaking to the Australian Prime Minister after he was elected as President Trump, he said that their healthcare system was amazing, and that it was envious to that extent. Do we have that clip, by the way?
Yeah, let me play it now.
All right, so take a look.
Sorry, I may not click at this.
It's going to be fantastic healthcare. Right now, Obamacare is failing. We have a failing healthcare. I shouldn't say this to our great gentleman and my friend from Australia, because you have better healthcare than we do. But we're going to have great healthcare very soon. Obamacare is failing. The insurance companies are leaving. Aetna just announced they're out from Obamacare. In some states, you look at a lot of states, a lot of different states. You look at Tennessee, you look at Kentucky is now in trouble. Iowa's in trouble. The insurance companies are all leaving. Obamacare is dead. So when you compare something to Obamacare, Obamacare is no longer.
Okay, it seems like we lost a little bit about that, but you can see that he was basically saying that Obamacare was dead. But unfortunately, the solution to the problem was to basically allow insurers to run amok again, to go to pre-Obamacare levels. That's basically what the Republican health care plan was. That's what they put on the table at any rate. And since then, they've made additional, or President Trump has made additional tweaks to the Affordable Care Act in the way that he can try in a way to basically destroy the program, such as removing the individual mandate, such as basically not defending in court the ACA, so that people with pre-existing conditions can now be discriminated against. His current Supreme Court nomination, pick, has gone on the record saying that the pre-existing conditions, the fact that they cannot be discriminated against, is basically an unconstitutional stance to take. What's your aspect of that, based off of what President Trump had said about the Australian healthcare system and what's being done to our healthcare system by this administration?
Well, I think the most obvious point is that Trump is a charlatan. And he ran on a lot of things that sounded great at the time, but I think a lot of people never expected him to follow through on those things. But it's incredible. What's incredible to me is that this president seems to, not only does he not care, he actively doesn't care. Like, it's not a passive, oh, I don't care. It's an active, like, I'm going to make things worse. And that will stick it to my critics, and that will stick it to all the people who didn't let me pass my health care bill. And, I will actively destroy Obamacare, even if it means throwing millions of people off insurance, even if it means millions of people getting not being able to get the care that they need when they get sick, and even if it means people dying. This administration is absolutely cold-hearted, and it's shameful. And it has to. I mean, this has to be This has to be just a 4-year affair. It can't go on for 8 years. People have to stand up because Donald Trump is actively working to make it so that your parents, your grandparents, your sick relative, your brothers, your sisters, your friends, your neighbors may face insurmountable obstacles if they get sick, in which case many of them will die. And that's just how he governs. So I have no love for this administration. I actively dislike what he is doing, and that is putting it as politely as I can.
I think that's a fair criticism. So we mentioned earlier about the ACA and what it ended up. Now, there were people that were pushing for a single-payer healthcare system when the ACA was being negotiated and constructed and talked about and things along those lines. Could you speak on kind of what happened to the single-payer healthcare proposal or plan or idea, if anything, during that time?
Yeah, so the Obama, when he was running for office, built up the largest grassroots movement in history. And he won with a historic mandate. And he had a supermajority in the Senate, he had a majority in the House, and he had this giant movement behind him. And what he did, instead of delivering on the promise of hope and change and really using his momentum, he kind of abandoned the grassroots. He shut them out, really at the advice of an aide named Jim Messina, who had ties to some of the most conservative members of the Democratic Party. And Messina convinced Obama to turn the writing of the Affordable Care Act over to these conservative Democrats. And they shut out the grassroots completely. They shut out the people calling for single payer or a public option. It was never on the table. It's never allowed to be on the table. And they basically, this one particular aide told the grassroots, this is what it's going to be. You're either with us or you're completely out, and that's it. And so that's really where we get the current structure of the Democratic Party, this top-down leadership. And I guess to an extent this was the model for Clinton, but it was really kind of galling under Obama because he had this momentum behind him, and he did have all of these people that believed. So I think that it will change. I think now the grassroots are having a major resurgence. They're electing their candidates. They're going to town halls. They're not being civil, and I think these are all very important things that separate them from previous movements before them. They're fielding candidates. So within my best prediction would be that within 10 years we have a nationalized healthcare system, probably a lot sooner.
I really, really hope you're right, because I think something about 45,000 people every year as a very conservative estimate die. Why is my thing flicking back and forth? I think about 45,000 people die annually every year due to inability to afford healthcare. That's a pretty conservative estimate too. And these are all preventable deaths. It's grotesque. It's grotesque that kind of half of the expenses on GoFundMe have to go to medical treatment. Specifically the United States, because we can't afford healthcare because the private industry gets to decide who dies, and they don't want to have to pay for expensive care or expensive treatment because, again, they get to decide the costs. Nobody's going to drop them because everybody wants to make a profit in the system. So there's no incentive for them to assure the maximum good. The incentive is for profit. And when you have a profit incentive over a life and death situation, I mean, it's a no-brainer choice for profit, right?
The death panels everyone was freaking out about. They exist. They're just not government death panels. They're insurance.
Absolutely. And then some people self-select too because they don't want to put their own family through that cost and through bankruptcy. Yep. So then they select out of the system. Say, it's not worth my family to have to go through this. If I die, I die. And that's just how it's going to have to be, which is very unfortunate, especially in the richest country in the world. It's atrocious. It kind of corresponds with a lot of things that are going on as far as like income inequality. The fact, again, that we mentioned earlier in this segment about half of the nation makes less than $35,000 a year. And that's horrible. That's not enough to pay for these healthcare expenses. That's at $10,000 per individual on average. It's horrible. It's atrocious. Let's see. Let's talk about some of our safety nets. So in this piece, you mentioned the person you're writing about mentioned about how she wasn't able, or she's not eligible to get on Social Security disability or Social Security or any of these social safety net programs that were supposed to be for people in her circumstance. Maybe you can't speak on her personal experience. Where do you see these programs heading?
Well, if they keep getting cut, nowhere good. I think that these programs need to be funded properly. They need to stop worrying. We need to stop concerning ourselves with budget and how much is providing assistance going to cost us, because all of these programs are underfunded, and when they're underfunded, they cut costs and they pinch pennies, and those are real people's lives that are impacted. So yeah, I think that we need to fund our assistance programs to the needy. I think we need to bring back traditional welfare and cut out the work requirements. Maybe we need a universal basic income. Probably need a universal basic income that's livable, that's comfortable, that is inflation adjusted, that keeps people at a solid middle to upper middle class lifestyle. And we need to extract this money from the people who are at the top, the billionaires like Jeff Bezos or Elon Musk, and we need to kill this ideology that the people at the bottom are not productive and the people at the top are. The people at the top are gambling with money. They are gambling with your money. That is not productivity. I would take the Latina maid with 3 kids, and with a sick family member at home, working multiple jobs. That is productivity. But working on Wall Street, let's be real, that doesn't make you a hero. So we need some wealth redistribution in this country, and that has to come through higher taxes. That has to come through a much more robust estate tax. And it has to happen soon.
Absolutely. Unfortunately, I don't see it happening under the current administration.
No.
And maybe you're a little bit more hopeful than I am, as far as the opposition party to the current administration, because I see them basically digging in to the same stuff, digging in, trying to protect the ACA and saying this model is what works, even though it left 40 million people or 28 million people uninsured and 40 million people underinsured. So they still are unable to afford it. They just have some basic insurance. So
I'm sorry.
No, go for it.
I was just going to say the situation with Democrats at this point is move or be moved. Elected Democrats in blue districts, and if you're going to be a centrist in a blue district, your days are numbered. You will have a primary challenger, and all the backing and money in the world isn't going to save you within the next few election cycles. Progressives won't win every battle. They won't win a majority of the battles that they fight, but they will get enough people in, they will start a caucus, and they will move this country left. They will recenter. And as the country recenters, the more middle-of-the-road Democrats will come on board with some of the more modest proposals. We saw this in 2010 with the Tea Party. Now every conservative is where the Tea Party was in 2010, moderate or extreme. They all agree on a certain set of goals. Judge Kavanaugh is considered a moderate Republican choice when he is to the left of Thomas and to the right of Alito. I mean, we have moved so far, and we will move it back. It's going to take activism. It's going to take energy. It's going to take people like Alexandria Ocasio-Cortez. I saw her speak in December, and she was one of the most passionate speakers I have ever seen, and I have to say, she made me a believer. We are going to fix this problem, or we will die trying.
So I got to admit that some people like myself that are on the left, it just seems very insurmountable, because of how much the politics, at least on the political spectrum, is right. However, the country as a whole, just the people, do lean left. So right now, nobody's represented. We're at a majority of people that do want a Medicare for all single-payer system. We're at a majority of people that want, in fact, a large majority, something about 80% of people that want sensible gun legislation. They want 80+% of people do want to protect the dreamers, but none of this is being represented in Wall Street, pretty much in Washington. And so it's a little daunting because it's like, which one do we tackle first? Because a lot of this does amount to people's lives, especially when it comes to healthcare, especially when it comes to poverty. So I'm overwhelmed by a lot of these things, and I'm discouraged. And it's great to see people like Alejandra, but at the same time, it's like the one solitary voice sometimes. It's one versus thousands of others. I don't want to be like negative Nancy here at all, because I do believe that hopefully I have to believe that we'll get on track. I have to, otherwise I'd go even crazier than I already am. So I have to believe that. So you're a prominent writer for the left, at least with left perspectives and things like that. How has your articles been perceived by some people, especially by hardline Democrats?
Well, I have to say the articles, I think, are received a lot better than the tweets. I think that the pieces that I write are generally they're not generally seen as super controversial at this point. This last article, I haven't really heard anything negative about. I mean, I'm sure that if I look hard enough, I'll find it. But I think that people really do relate to personal stories, and when you can humanize an issue, and when you can put it in terms people understand, I think it goes over really well. And so I've made an effort, at least. I don't really write op-eds much anymore. I say after writing an op-ed last night, but I try to do more reporting about people and human issues, and I think that there's a demand for that, and a real need for it as well. And so even, yes, I am left, and have my circles of people that like my opinions, but I think that the major points that are made in the reporting resonate with most Democrats. And
That's actually a really positive sign. Something that you just mentioned about kind of humanizing an experience, or I guess making an experience more human, because we're in a culture, right, that is very individualistic, and you feel so isolated, as if you're the only one having a certain experience, because we don't get to see this side a lot of the times, or these people. I mean, I think she mentions in her article about having to kind of buck up and continue on, to work hard, and then you'll be successful, and don't complain, and don't, even though you have an illness, and you have every right to be ill, and to take care of yourself, and to need to take care of yourself. But in our society, it's pretty discouraged. So what's your thought? And I know this is kind of out of the scope of the article, but I think it's kind of you approaching this in a more humanist way, about empathy and needing more of it infused in our culture. Do you think that this is kind of a way in which to do this, to make an experience more human?
Yeah, absolutely. And I mean, this is not a new concept either. I mean, this is what journalists do all the time. They write stories that about bigger issues that through the lens of a single person. I think I didn't really break any ground with this story. I just wrote what was already there, and every few months, I think a story like this is needed to update from the last time it was written. I see it as more in a continuation of what's already been done, and I think that's a good thing. But I just wish that stories like this were more prominent in mainstream reporting generally, television reporting. I wish that they did segments on this, not my story specifically, and not my writing specifically, just in general. I wish that they would cover these issues. We have decades of middle class decline. We have most Americans not able to afford $1,000 emergency. Millions of people who can't afford insurance or can't afford health care. Most people working paycheck to paycheck. Most people living in debt. The life expectancy has gone down. The college enrollment rate has gone down. People are glum. People feel like their side is losing all the time. Like, this stuff, this should be, every network should be focusing on this. And meanwhile, the other side of it is that the rich have never been better off. They have never been richer. I mean, I grew up in East Hampton, and in the summers it became the playground of the rich and famous, and it's progressed since and just become, every time I go out there, it's like Main Street changes. There's different pop-up luxury store, more and more private jets at the small little local airport, and these people are living well, and they are living peacefully, and there is no protest out there. There should be people outside these people's homes. They should wake up in the morning to the sounds of protesting. They should go to sleep at night to the sound of protesting. That should be their lives. Living in excess should come at a cost, and it doesn't. It really doesn't. It is convenient. They go to their soirees. They drink rosé. They have they congratulate each other on their excesses, and that is not real life. It is not real life for most of America, and until there is some level of friggin' equality, or at least human dignity, a standard level of human dignity for people in this country, civility has to go out the window. These people have to know it, and news should be covering it.
So there's two things that I want to ask you about. One is kind of related to this point that you just made about kind of how the wealthy are living and how there should be consequences for it. Why do you think no one is out protesting, at least in mass? What do you think the reasoning is there?
Well, if you can't take off work to spend time with your family, are you going to take off work to go and protest at some rich guy's house? Probably not. I think, we have made it almost impossible to be an activist today and to go out. And it's funny that the generation that, grew up during the civil rights movement and anti-war movement are really the ones who have kind of done this. And it's not the majority of the generation either. It's just the representatives of that generation. I don't mean to I'm not casting aspersions on boomers or and generational politics. I generally don't subscribe to. But it is the representatives of that generation that have made it difficult. And it's because everybody bought into this dumb idea that the wealth will trickle down. Reagan was a great salesman, a terrible president, but a great salesman for radical free market economics. And that's why we don't see the protests.
Yeah, absolutely. It's insanely difficult to do so, especially when you're working 3 jobs and having to feed 2 to 3 people. Yeah, they've made it nearly impossible. Before I get to my second question, can I just say, can we start having people potentially ask questions now, Janet or Lauren, if they want, and just you guys look out for that? Is that okay?
Yeah, I'm gonna probably jump off in a few minutes only because we have the interview coming up.
Yeah, that's fine.
I wanted to share my story, but we can do that some other time because my story lines up really well with Taylor's.
So does that mean Lauren's going to be picking up phones if anybody does happen to call in?
I didn't even put out the phone number. So do you want me to put out the phone number? I can stay
I was just about to.
All right. All right.
Let's call.
We were kind of iffy about the phone today, so I will open Skype now, I guess, and I'll stay on. I'll have to jump off at 5 though.
Yeah, that's fine. We'll do just internet comments.
We have to end by then. So.
Yeah, we'll do internet comments more when you need to definitely go. But if you want to call in, the number is 508-534-8585. Okay, to my second question, Walker. So there's been a conversation in the Democratic Party about access versus affordable. You hear somebody like Nancy Pelosi, I want everybody to have access to health care, whereas she's not saying I want everybody to have health care. Could you potentially clear up that distinction for us?
Well, I think Senator Sanders said it best when he said access doesn't mean a damn thing. And I would invite Minority Leader Pelosi to give up her government insurance and enter the private market. And maybe give up her salary as well, since she is being fine. I think that our elected leaders having government health insurance is the biggest hypocrisy, and denying it to everyone else is the biggest hypocrisy that exists today. I mean, you can't have health care. Your family has to. You've got to go without, and if you die, you die. But me, thankfully, I'm covered. I'm good. I've got this. I don't think that if you're relying on the government and it's good enough for you, how dare you deny that to somebody else? How dare you look your constituents in the eye? And how dare you tell us that we will not be able to have it, and that we're capitalists and that's just the way it is? No, the way it is that we are going to change. It's move or be moved. So that's my sorry.
No, that makes a lot of sense. So you can have, health care, but it doesn't mean you can have health insurance, but not necessarily have access because you can't afford the care. Right. Because of the high deductible, because of the co-payments, because of just the high costs of medical care in and of itself in the United States. Again, the rest of the modern world has no idea what medical bankruptcy feels like. They think that is such a foreign concept because it doesn't exist. It only exists in states. And then you have our elected officials that are comfortable on government supplied health insurance, essentially. And it's good health insurance. They get taken care of. You have somebody like Senator McCain that has the brain cancer, essentially, and was able to get surgery like that, no problem, in a blink of the eye, and yet still voted to remove the individual mandate.
If John McCain were a poor woman of color and not a senator, he would be dead.
Yes, absolutely.
Let's call it what it is. This is part of the oligarchy. Elected officials, they might not be rich, but they're in the club. They're in the club because they hold the keys to power. They make the decisions. So they're in the club, and they don't want to lose that privilege. They don't want to be ostracized. They want to go to those soirees. They want to go to the big dinners in DC. They want to be part of it, and they are. And you know who else is part of the club? Big media people. Big media people at CNN and Fox and MSNBC. They go to these events too. They sit there. They hobnob with billionaires. That's just the world we live in, and they're fine. They'll be fine if they're sick.
Yeah, I mean, this is one of the biggest issues that, frankly, just as you mentioned, it's a crime that it's not being covered, and it's only covered on very small organizations, but it should be widely distributed because this conversation needs to continue. The fact that our elected officials have health care while the majority of Americans don't really have health care, or have to pay outrageous costs to get it. And somebody mentioned in our comment that this dude, I think, Plantastic Life mentioned, I think they're mentioning you, Walker, that this dude makes it.
I have a call to Amanda. I'm sorry. I just want to, because we only have like 5 minutes before I'm getting off, so.
Okay, let me make this comment and then we'll do the call. Plantastic Life mentions this dude makes a great point. We should all demand the same health insurance plans as our representatives. All right, go ahead.
All right, so Mark's on the phone with you. Mark.
All right. Hey, Mark.
Hey, Walker. I met Walker at the meetup. He's a totally cool guy, and I'm glad he's on your show tonight. So. Hello?
Hello.
Hi, Mark.
Yeah. Can you hear me?
Yeah.
Okay. All right. So this is what I'm gonna say. America is a disgrace. When you have people dying because they can't afford health insurance, but other countries such as Canada and Norwalk and Denmark, they have free health care, but America doesn't. That's a disgrace. And the other thing is that people who are on Medicaid, there's some people who have free health insurance who are on Medicaid, but the working and middle class people who work jobs that cost like more money, they're on private health. They're on like health insurance, private health insurance, and they hate the people who are on Medicaid. So it pits people together. It pits people against each other. It pits poor people against working and middle class people because they don't have Medicaid. They're on private health insurance while the other people, they have Medicaid. So it pits people against each other, because everybody's not on Medicaid. They're on private health insurance and they have to pay a lot of money on health insurance, so it really is a disgrace, because, it just is, I mean, why is America the richest country in the world and, we don't have universal health care, but Canada and Denmark and Norway has? I mean, America sucks. America is the greatest country in the world. I wish I could move.
I mean, and even with Medicaid, there are certain conditions, certain illnesses that are very difficult to get care for, adequate care. Mental health on Medicaid is incredibly difficult.
Well, I'm on Fidelis Medicaid. I'm on Fidelis Medicaid, and Medicaid, doesn't cover everything. It doesn't cover everything, but luckily I'm on Fidelis Medicaid because I have a disability, so I'm on free. I have free health care, fortunately, But my mom, she has to pay $15 copay every time she goes to the hospital, and other people, they have to pay copays and worry about paying other health insurance every time they go to the doctor. So people who have to pay health insurance and people that have free health insurance, it pits those people against each other. They hate on the people that have free health insurance because they're paying for their health insurance. Get it?
Well, it's much easier if people are divided. It's much easier for people at the top if everybody else is divided.
Yeah, I think, yeah, Mark. So it seems like it's almost intentional, right? It's easier to assure that we continue to fight, not target the people that are actually making these decisions and making it hard for everybody to live. And then say, well, it's the people on Medicare fault. They're the ones that are getting your money. They're the ones that get the free health care, and they're not putting into the system like you guys are. But if we had a universal system that was covered by the government, that did pay via taxes, we couldn't really be divided about that because everybody's on that system, right?
The problem here is that rich people don't want to pay taxes. That is the entire. I mean, there's a lot out there. People who try to find like the most horrible, conspiracy. Like, why are they doing this? They're doing it because they want mind control. They want whatever. Now, the real answer here is that rich people just don't want to pay taxes. They don't want to give up what they've got. That is the entire problem in America, and that those rich people have undue influence on our elected officials. If we take away that influence, we are talking a very small minority of people here who have everything, and them having everything means that you don't have enough to live. So the simple solution is take away their influence and with clean campaign finance, and then tax them. You should not have billionaires in this country when you have people who have nothing, living on the street, nothing. That should not exist. That level of disparity is criminal.
Absolutely. Now, something that you just mentioned that is, I need to dig down further into this. There was a Reddit post. I don't know how old it is, honestly, but it basically said that people kind of assume that these wealthy individuals are all kind of communicating, working together really hard to assure that they stay at the top and that the bottom stays a permanent underclass, et cetera, et cetera. But when it comes down to it, that all they have is overlapping interests, like not wanting to be taxed. And they're not really as organized as we're kind of assuming that they are, or some of us do. And that if we did have a huge resistance movement, that their little power structure would collapse quite instantaneously, or quite quickly, or more quickly than we would assume. Do you kind of subscribe to that idea, Walker?
Yeah. Oh, absolutely. Yeah, get organized, get out there, get in the streets, go make some noise, disrupt, please disrupt. Protests today, everything is so relegated to, oh, this is the approved protest area. That is not what this country was founded on. Go out and exercise your fucking free speech rights, your free expression rights. And if you don't have a lawyer, that you can talk to, shoot me a DM if you need to know what you can and can't do. Like, go out, make some noise, make these people's lives a little less pleasant. We had I'm in law school and took a legal ethics class, and we had an attorney from Goldman Sachs come in. He was telling us how inconvenient his life became when Occupy happened, and how it made him really have to consider, a lot of things. And good. That means it was working. Do that. Go out. Make noise. Get into, as John Lewis said, good trouble. And then remember who you saw there, unlike John Lewis.
It kind of reminds me of this, the one-man protest. I don't know if you've heard about this or read about this anywhere, but it had to do, I don't remember even the location, and I think I've told this story before on the program about this one man. He was Black, and he was part of a neighboring Black community that was next to a wealthy white community. And pest control was, I guess, kind of more of a thing back then. And well, it's a thing now, right? And pest control would only come to the white neighborhood. And so all of the pests would end up running into the Black neighborhood, and they couldn't get pest control there. And so what this guy did is he gathered up rats, stuck them in his car, and just drove around the wealthy white neighborhood and said, I'm going to release these rats unless pest control comes to our neighborhood. And he did this like for a few weeks, every day for a few weeks, one guy. And then suddenly pest control came. So, I mean, that just shows you the power of even one person, too.
Yeah, you just go out. You never know the impact you'll have. You never know. And again, if you don't know what your rights are, I will find somebody who is a lawyer who will talk to you. DM me, please. Make noise. This is the incitement part of the broadcast.
Absolutely. We're actually almost to a close here, so I'm going to read a couple more comments with the remaining time that we have. And of course, Walker, feel free to jump in at any point. Mark said, we need to occupy Hamptons. I didn't know this, so that's interesting. Plantastic Life mentioned Richard Nixon came very close to enacting unconditional income for all poor families, but was then talked out of it by Martin Anderson. And Ayn Rand disciple, of course, they would be. UBI is not a new idea.
Nope.
That I do know, UBI not being a new idea. I didn't know about the Nixon.
But without redistribution, a universal basic income will just amount to, crumbs. And that's right. Can't be. It has to be living, not just living like, able to get by. It has to be comfortable.
Oh, absolutely.
Guarantee, people need dignity, and they will have it one way or another. And if things keep going the way they are now, it's I don't want to speculate about it, but it's dangerous.
Yeah. I keep saying that we're talking about this thing so that it doesn't get to that point.
Right.
Right. So that we can, say that we can actually, can have an impact now. We don't need to get there. We just need to do it. We just need to kind of get up and stop being scared. I know some of us are scared to protest and be in the streets and get arrested, but the thing is that if you're enacting your rights, your constitutional rights, you should technically be fine per the Constitution, and things like that. And there are attorneys that will help you at least kind of outline what you need to do and things like that. It sounds like you have some great resources yourself that you're willing to share, because we don't want to see it get to the point where people can only get pushed so far before things snap. Because in history, there's a historical precedent where when it gets too bad, people snap, and we don't want to get there. I know there are advocates on the left that do want to get there, that want to see that happen. I personally am not one of those people.
They want to see it happen in theory. We're actually, people have fantasies about it.
Right, and it's probably coming out of a place of anger too, because living out that fantasy in your head. But that experience is not something anybody should want to go through at all, because people die, innocent people die. When I keep coming down to the fact that all of this strife, all of this all of this pain, the people dying needlessly, are preventable.
Yeah, it is.
Simple.
And if we can prevent it, we have a responsibility to prevent it.
Absolutely. So I want to thank Walker once again for being on the program. So Walker, thank you so much.
Well, thank you for having me.
Yeah, anytime. And I love reading your stuff, by the way. I'm a fan. I think you write really well and very clearly, which sometimes it's that can be for some people to do challenging. But I do appreciate you being here and kind of detailing the information that you've provided in your piece with us, as well as talking about a few other issues. If you haven't read it, please go out and read Living with an Invisible Disability in Donald Trump's America. It's a really good, easy read. It's heartbreaking, but it does kind of shine a light on some of the issues that people do face in the United States. So just a good piece. Thank you so much, Walker. And thank you guys for joining us today. I really do appreciate it. Thanks for the call, Mark. It was nice talking to you. Thanks for your comments as always. And if you haven't already done so, please subscribe to our channel. And if you want to receive notifications as far as if we upload a new video or whenever we go on live, please hit that bell and consider donating to our Patreon page. That is also linked in the description. Just $1 a month is all you need to keep us afloat a little bit. We do have operating costs, and we do appreciate you guys being with us today. We will be back live on Thursday. We have an interview coming up that I think you guys will like with, God, I forgot her name. Lauren, help me. Seema, thank you. A lot of you guys know who she is. But thank you guys so much. We will be back later. Bye, guys.